Hello, hello. Are you guys able to hear me? Hello, please raise your
Yes.
hands. Okay, perfect. So, mhm. Okay. So, as you guys know that today is our third day of cardiovascular workshop, and today we are going to wind up really important topics which your USME love to test you. And just remember, right after this session, we are going to have an assessment for of 40 questions. Those who just took part in assessment, they'll be given opportunity to join our 120 days marathon. A lot of students are joining and we have very limited slot left. So those who are interested, they can just contact Dr. Hamza or me directly. Okay. So let's start our session. Okay. So yesterday okay, we discussed anatomy, we discussed a lot of topics, we discussed some of the concepts of physiology and Hill Frank Starling mechanism, right? So today we are most likely going to be focusing on heart sounds, right? So can anyone just tell me that when do we hear heart sound? My question is, whenever the walls are open, they will produce sound, or whenever the walls are closed, they will produce sound. What do you guys think?
Closed.
Closed. Closure.
Okay, perfect. So basically, the wall closure, basically, okay, just give me a second. So whenever the walls are closed, that would produce sound. Okay, that's very important. Okay, opening of your valves do not produce any sound, right? So we have different sounds. We have S1, we have S2 hard sound, we have S3 hard sound, and we have S4 hard sound. We are going to be discussing each one in quite detail. Okay, so I want you guys to be telling me that S1 hard sound is produced by closure of which valves? Yes.
Atrioventricular valves,
No.
mitral and pulmonary.
Perfect. So whenever you're mitral or okay, mitral and pulmonary or mitral or
Yes.
tricuspid.
Tricuspid. Oh, sorry,
Yes,
tricuspid. Yeah.
you were just saying pulmonary.
Tricuspid.
Okay, perfect. Okay. So whenever your mitral valve and tricuspid valve close, they would just produce a sound which is S1. Okay. Very important. Can you guys just tell me at which location we are going to best hear S1 sound? Very important, very high yield. Can you just tell me the location?
Intercostal space.
Yes.
15 space.
Second
Mm-hmm.
intercostal space.
Second enter. Okay, what do apex? Apex of your heart. Hello?
Mitral area.
Hello?
And
Yes, I want you
4
guys
and
to
5
answer me.
intercostal space.
What's
Sorry.
the
Left sternal
auscultation
border.
point where we can best hear your S1 heart sound?
Left
Okay.
sternal
At
border.
the okay, right or left side, fourth or fifth? For the
Left.
basically for the
Left,
tricuspid
left
and for
side.
the mitral valve.
Left
Okay.
side.
For the mitral
Side.
valve, apex. Okay, apex of your heart. Right?
Yes, yes.
Hello? Are you guys
Yes.
getting me? Apex of your heart. Can you guys just tell me what is apex of heart?
Point of maximum impulse.
Left ventricle.
Okay, perfect. It's a point of maximum impulse. How do we find, for example, if I have an individual, he's just coming to a clinic. If I want to find exact the apex of heart, so we have certain landmark for that. Can you guys just be telling me? Okay, let me just give you a single clue. Mid clavicular
Mid
Mid
clavicular.
clavicular
space,
line.
mid
Line.
clavicular,
Mid clavicular.
which intercostal space?
Fifth
Fourth or fifth?
Fifth intercostal.
Fifth intercostal space.
Alright. That is mid clavicular line and fifth intercostal space. So, whenever we have an individual, if we just find the midclavicular line and in the fifth intercostal space, we'll be having apex of heart. And at the apex of heart, basically we are going to hear closure of mitral valve, right? Or if you have any problems with mitral valve, for example, if you have mitral regurgitation or if you have mitral stenosis, again, it would be best heard at apex of your heart. Very important, very high yield. That just keep that in mind. Okay. So we discussed that S1 heart sound is basically produced whenever we have closure of mitral and tricuspid valve, right? So my question for you guys is, when do mitral and tricuspid valve close? During systole or during diastole? What do you guys think? Yes,
During systole.
Systole.
systole. Systole. Yes, that's okay. Like for example, if this is your heart, let's suppose your heart is filled with blood. Let's suppose during systole, what happens? What's the main goal of systole we discussed? During systole, the blood is going to enter from the ventricle into aorta, like, and from the right ventricle into your pulmonary artery. At that time, your valves should be closed. Your AV valve, that is your mitral and tricuspid valve, should be closed during systole. Why? In order to avoid bad flow of blood into atrium, like we do not want the blood to enter back into the atrium, while we want the blood to enter into aorta and your pulmonary artery. Okay, so for that reason, we should know that whenever the systole start, both of your mitral and tricuspid valves are going to be closed, and they're going to give you a heart sound, which is known as S1 heart sound. Is that clear? Hello?
Yes,
Hello?
sir.
Are you guys following
Yes,
me?
sir.
Okay.
Hello.
Okay, that's perfect. Let's discuss our S2 heart sound. So as you already know that heart sounds are always produced whenever the valves are closed. So you guys are going to be telling me that when do we hear S2 heart sound? Closure of which valves?
Aortic and
Aortic and
pulmonary.
Valve.
pulmonary.
Aortic and pulmonary valve.
Perfect.
Aortic and
Aortic
pulmonary
and
pulmonary
pulmonary
valve.
valve. So let's just draw what is aortic and what is pulmonary valve. We know, for example, if this is your heart, you have your ventricles. Your ventricles, here lies your mitral valve, here lies your tricuspid valve. Then we are going to have an aorta arising from your left ventricle. From the right ventricle, we are going to have pulmonary artery. Here again, we are going to have valves. This is going to be your aortic valve, and this is going to be your pulmonic valve, right? So these are your aortic plus your pulmonic valves. And whenever these valves closes, they're going to be producing S2 heart sound, right? But one thing which you guys should note that normally the S2 heart sound is split. What do I mean by split? And why do we have splitting of S2 sound? That's very conceptual topic. So today we'll be spending some time on S2 splitting, right? So first of all, what do we mean by split? Like for example, whenever you are hearing S1 heart sound, you can just simply hear it as, okay, you guys know that normally the heart sound can also be called as lub and dub sound, right? Lub, dub, S1, S2, lub, dub. Are you guys following me? Lub, dub, heart sound, right?
Yeah. Yeah.
So
Yeah.
you have
Yeah.
S1,
Yeah.
S2,
Yes.
S1, S2, S1, S2, and on your stethoscope, they're going to, like we heard as love dub, right? But sometimes what happens, this S2 heart sound can split into two sounds. Like you'll be hearing love and drop, right? Not love dub, love and drop. What drop mean is that S2 heart sound is splitting. You can obviously just hear that S2 is splitting. So why do we have that splitting of heart sound? Very important, very high yield. So let's just deep dive, dive deep into the concept. Okay. So for example, if this is your heart, right? Let's suppose we discussed that aorta arising from your left ventricle. From your right ventricle, we have pulmonary artery, and this is your left ventricle. Okay. So what happens that we discussed, this is going to be our aortic valve, this is going to be our pulmonic valve, right? And your aortic valve. Okay. These are your atriums. So sometimes what happens that your aortic valve closes earlier than your pulmonic valve. As we discussed that S2 is produced by closure of both of these valves, right? But sometimes what happens that your aortic valve is going to be closed soon while your pulmonic valve is going to be closed a little bit later. So that's why the heart sound, that is the A2 component, like we know that, for example, this is your S2 heart sound. So S2 heart sound, we know it's basically produced by closure of both of your aortic plus pulmonic valve. It means that A2, like this S2 sound, have two components. A2, which is basically closure of your aortic, and it have P2, which is closure of your pulmonic valve, right? Are you guys following me? Hello?
Yeah. Yeah.
Yes.
Hello.
Yes,
Yes,
yes.
Okay,
sir.
perfect. So, as you guys know that aorta is going to feed into systemic circulation, right? While your pulmonic artery is going to feed into your lungs. You know that, right? And we know that systemic circulation is high resistance system. The resistance within the systemic vessels are very high. We have a lot of arterioles here. Why? The resistance within the lungs are very low. They are low resistance. They are more compliant. They are more elastic. They can accumulate a larger amount of blood, right? So you guys can simply think of, if we have high resistance, if like if your aortic valve or your aorta is going to pump against higher afterload, it have high load, or in other words, yesterday we discussed this have like the aorta have to pick up more kgs of dumbbell, right? So it means that if the load is high, it means that aorta is going to be closed soon. Why? Because the load is high. Are you guys getting me? It's going to be fatigued soon, so it's going to be closed soon. So as the aorta close soon, what happens? S2 is going to split. So closure of aorta is going to give you A2 component, and you know that it is less resistant system. So it would just take more time for this valve to close. It can easily remain open. Blood can enter for a longer period of time. If blood is entering into the lungs for a longer period of time, it means that this valve is going to be remaining open for longer period of time. It means if you compare it with aortic valve, so aortic valve is going to be closing soon, while pulmonic valve is going to be closing late normally. Why? Due to the system which they are feeding. Like aorta is feeding high resistance system, so it must be closed soon. While pulmonary artery is basically feeding into less resistant system, it is going to be closed later. Is that clear? Hello?
Yes, sir. Yes, sir. Hello.
Okay,
Yes,
that's
yes.
perfect. That's
Yes,
perfect.
yes.
But this S2 splitting can be, can be heard very prominent during certain phases of your respiration. We know that during respiration, we have two phases, inspiration and expiration, right? So we'll be discussing a little concept, right? Inspiration and expiration. We know, okay, what happens in inspiration? We know that air is going to enter into your lungs. Am I right?
Yes.
Hello? And how does the
Hello.
air get into the lungs? For example, if these are your lungs, right? During inspiration, for example, if this is your thoracic cavity, so during inspiration, what happens is that basically your thoracic cavity volume or size would increase. Why? In order to give more space for your lungs, in order to get like more space for the lungs, and lungs would expand. And due to this expansion, what happens? Air is going to enter your lungs, right? So can I say that during inspiration, okay, just give me a second. Okay, so can I say that during inspiration, the pressure within the thoracic cavity decreases? Can I say that?
Yes. Yes.
Okay, so during inspiration, what happens? The pressure within the thoracic cavity would decrease. Why? We are seeing it here, right? Because it would expand, and expansion lead to decrease within the thoracic, decreased pressure within the thoracic cavity. So we know that heart also lies within the thoracic cavity. For example, if this is your heart, right? Your beautiful atria, your ventricles. So these are going to be like, let's suppose, superior vena cava. These are going to be your pulmonary veins and your ventricles, okay? So we know that heart also lies within the thorax. So during inspiration, what happens? The pressure would decrease, okay, the thoracic pressure. So as the pressure is decreasing, so we know that the right atrium, okay, this is your left atrium, okay, this is your left right ventricle and left ventricle. So this decrease in pressure is also experienced by right ventricle, right? So what happens? The pressure here is also going to drop down because it's present within the thoracic cavity. Whenever the surrounding pressure drop down, pressure within the atria, the right atria also decreases. As the pressure decreases in the right atria, it means that if I'm expanding right atria, it means that now more blood can enter the right atrium. Can I say that?
Yes.
So
Yes.
can I say that during inspiration, your right atria is going to be filled with more blood, or the preload to the right side of your heart is going to be increased. Can I say that?
Yes.
Yes.
So preload to the right side increases. But during inspiration, you know that more blood is now going to flow into your lungs. Lungs are also expanding. When lungs are expanding, it means that lungs are keeping more amount of blood with it. It means if lungs are keeping more blood, so the left side of the heart is going to receive less blood. So can I say that during inspiration, the right-sided preload increases, but the left-sided heart preload would decrease? Can I say that?
Yes, yes, sir. Completely.
Perfect. Perfect. Let me just summarize it here, okay?
So,
So what happens? Yes, please.
why only right atrium experiences this decreasing pressure?
That's a good point. We know that right atrium it's a low pressure system, right? And left side is high pressure system. You know that, right?
Yes, sir.
Right? Okay. So whenever there are pressure changes, so it's a common sense. The low pressure system would experience more change, or the high pressure system?
Low pressure.
Yes. Yes, because like you can see there is it's a high pressure system. What do I mean by high pressure? It's already being this it's already like distended. It have a lot of blood within it, right? The pressure is very high at the left side, right? But when you compare it with the right side, the pressure is very less. Okay, let me just give it. Okay, just give me a second. Okay, let me just give you an example. Okay, okay. For example, if you have two balloons, right? Okay, the one balloon, it's like you have just filled less air within the this balloon. It means the pressure is very less, okay, within the balloon. And as compared to the other balloon, it's filled up more, right? Hello.
Yes.
Yes,
Yes,
sir.
sir.
Yes,
If
sir.
I'm just changing the pressure, let's suppose if I'm just changing the pressure surrounding this both of these balloons, right? And I'm decreasing the pressure. If I want to extend, let's suppose if I want like decreasing pressure means same as I'm just like pulling the balloon surfaces outward. So what do you think? Balloon number one would just experience more impact of their decreased pressure, or balloon two?
Balloon man.
Balloon one.
Yes, because the balloon 2 is already, like it's already extended to its maximum limit, while the balloon 1 still have, the capability to be expand, right? So here you guys can just consider it as a balloon 1. It's a low pressure system. If the pressure changes occur in the surrounding, so it means balloon 1 is going to have more changes. You can just expand balloon 1. And this is the example of balloon 2, right? It's already a high pressure system. It's having a lot of air or a lot of blood within it. So if I'm just changing the surrounding pressure, so there would be more impact on balloon 1. Is that clear now?
Yes. Yes, sir.
Perfect. Okay. So that's why the right-sided heart is going to be impacted more. Okay. So I was just basically giving you okay, summary whatever we discussed. So during inspiration, we discussed that what happens, the thoracic cavity sigh, okay, the pressure would just drop down, right? And as the thoracic pressure cavity drop down, your right atrium, it's a low pressure system, it would expand. As it expand, it would accept more blood, right? Are you guys following me?
Yes, sir.
Yes.
As it accept more blood, it
Yes.
means that the preload to the right side would increase. While on the left side, we know that it's a high pressure system. You have less impact on the surrounding pressure change, And another thing which we mentioned, that during inspiration, what happens? Your lungs would expand. As the lung expands, so lung would keep more blood with itself. If lung is keeping more blood with itself, it means that the left atrium is going to be having less blood, right? If the left atrium is going to have less blood, it means that the left-sided preload would decrease. So ultimately, in inspiration, I would say that the right-sided, just note it down very high yield, right-sided preload increases while the left-sided preload would decrease, right?
Yes.
Okay. So why am I just emphasizing on these points? Why have I just spent a lot of time on that? The reason for that is that keep in mind, if the preload to the right side increases, just think. So it means that now the pulmonic valve is going to be closed later. It would just take more time for the pulmonic valve to close. Why? Because if the preload to the right side increases, now it would take more time for the blood to enter into the lungs because we have more blood, right?
Yes.
Yes.
While if the preload on the left side decreases, it means that now aortic valve is going to be closed soon. Why? Because we have less blood to exit from your left ventricle. If you have less blood to exit from the left ventricle, it means that the aortic valve is going to be closed soon. So will we be seeing splitting during inspiration? Yes or no?
Yes, yes.
Perfect. So it means that S2 splitting is observed mainly during inspiration. And we know the concept why. Because the preload to the right side increases and to the left side decreases. Due to that, it will just take more time for the valves to close. Okay, so that's the reason. Just keep that in mind. Let's discuss our S3 heart sound. Very important. These heart sounds are very important. Just keep that in mind. Okay, so S3 heart sound. Who is going to be telling me what is S3 heart sound?
When the blood, uh, yeah, it is a normal sound. Sometimes physiologically sounds, especially for pregnant women and athletes.
Mhm.
But sometimes when we have a stiff wall of the heart, we will hear the sounds.
No, for the stiff wall that is S4. For the stiff
Okay.
wall, it's S4, not S3.
Oh, okay. When
Because
the
of your
blood
dilated.
touch to the wall,
At the end of the rapid filling, in the diastolic phase. After
Okay,
A2, we
during
can
rapid
hear
filling.
it.
Oh, okay. Okay, so let's just discuss it in detail. Okay, so S3 heart sound basically it can be like normal in certain group of individual, while it can be abnormal in certain group of individual, right? As doctor just told us. But before knowing that is it a pathological heart sound in an individual or is it normal, we should know the concept. When do we hear S3 heart sound? We should just dive deep into the concept first. Okay, so basically, during diastole, diastole. What is diastole? During diastole, we discussed that the heart is going to be filled with blood. Okay, like for example, if this is your heart, right? So during diastole, what happens? Your heart is basically filling with blood. Okay, so during diastole, what happens? Heart is filling. Your ventricles are filling. I'm just like emphasizing on this point. How do our heart get filled? We know that, for example, if this is your mitral valve, what happens? First of all, let's suppose if this is the blood which is accumulating within your atria, we know that the pulmonary veins are going to drop blood from the lungs into your left atrium. Are you guys following me?
yes,
Yes.
sir.
Hello.
Yes,
So
yes.
during the diastole, during the diastole, what happens? We know that during the end of systole, some of the blood is left within the left ventricle. We yesterday discussed that is known as end systolic volume. Do you guys remember?
Yes.
Yes.
And systolic volume. Okay. Okay. So during the diastole, what happens? First of all, these valves are going to be opened. And as these valves are opened, so the amount of blood which is already present within the left atria, first of all, it would just come down. And this amount of blood is going to hit the surface of your blood, which is already present within your left ventricle, right? So as the blood enter into your heart, And as this amount of blood hit the surface of the blood which is already present in the left ventricle, in some individual, it is going to produce a sound that is going to be called as S3 heart sound, right?
So,
So
sir,
it's simply, it's
it
simple.
happens
In
in
some,
rapid ventricular filling.
okay, sorry,
Does it happen in rapid ventricular filling in first phase
it's
of the
basically
actual?
It's basically an early ventricular filling, right? Early rapid ventricular filling. Because as we just opened the valve, the blood which is already present, it would rapidly get into your left ventricle because it's already present. You're only opening the valve. If the valve is open, the blood is going to come, it's going to come down, it's going to splash, it's going to hit against the blood which is already present there and it's going to give you S3 heart sound. But in which kind of individual? You can simply think of in those individuals who have like dilated heart, right? In which the chamber, the left-sided ventricular chamber is like dilated, like we'll be discussing in detail. Like, for example, we know those who are having eccentric hypertrophy. What happens in eccentric hypertrophy, the vessel size increases. So as the vessel size increases, now the surface of blood is more. If the surface of blood which is present in dilated heart is more, so now when we open the wall, the blood is going to come, it's going to hit the surface of this, like the big surface of the blood which is already present within the left ventricle. So we are going to hear a prominent S3 heart sound. So it means S3 heart sound is always produced within the individual who are having like dilated heart chamber. How do we get dilated heart chamber? Eccentric hypertrophy. How do we get eccentric hypertrophy? Whenever when we are in volume overload state. Remember, whenever we are in volume overload state, so your heart is going to undergo eccentric hypertrophy. We'll be discussing in details in our marathon session what is eccentric hypertrophy and everything in detail. But as the doctor just told us, in pregnant woman, basically it's a normal heart sound. Why? Because in pregnant woman, she is in volume overload state. Why? Because a pregnant woman have a baby inside her, you could say, abdomen. For that reason, physiologically, the amount of blood which your mother is producing, it would increase. The amount of plasma increases in order to provide nutrients to the baby as well. So due to that, pregnant woman is basically having volume overload state. And whenever we have volume overload state, what happens? It would undergo eccentric hypertrophy. And eccentric hypertrophy is going to increase the vessel cavity size. If the vessel cavity size increases, now we have a big surface for the blood. So whenever the mitral valve open, now the blood is going to hit the surface of the remaining amount of blood. It would just give us S3 heart sound, which is normal because pregnancy is normal. Are you guys following me?
Yes.
Yes, sir.
Yes.
Perfect.
Doctor,
Yes, please.
I have a question. So basically, S3 sound is due to the turbulence of the blood against the enlarged surface of the left ventricle, the turbulence of the blood itself, or because the blood coming from the mitral from the atrium is
The
hitting the
blood
blood
coming.
that's already present.
Mhm. Yes, the blood coming from the atrium is hitting the surface. Is hitting the surface. That's why we are gonna hear this sound. This sound is going to be more prominent whenever the surface of the blood, which is already present within the left atrium, is more. How do we get that more or that big surface of blood? Whenever we have dilated heart. How do we get dilated heart? Whenever we have volume overload state. These are the things which your assembly want to test you. You have to kind of interconnect things with one another. Is that right?
Right.
Perfect.
Yeah, sure.
So can I say that S3 heart sound is also early diastolic heart sound
Yes.
because it's the first
Yes.
phase. Whenever what is the
Yes.
first phase of diastole? The first phase of diastole is opening of your valve. Once the valve open, blood is going to come. It's going to hit the surface. Once it hits the surface, it's going to give us S3. So in your UWorld question, whenever you see that we have an individual who is like a marathon runner, in like which you guys are going to be soon, you guys are going to join a marathon. Okay, so you are also going to be a marathon runner. Okay, okay. So what happens? In those individuals that are going to have eccentric hypertrophy, like endurance exercises also lead to eccentric hypertrophy, right? So in athletes, it's also going to be normal. Why? because again they're in higher volume overload state. Their heart is going to deal with a lot of blood as they are running marathons. So what happens? Heart is going to undergo eccentric hypertrophy. Eccentric hypertrophy is a good hypertrophy. Remember, right? Concentric is a bad hypertrophy. Are you guys following me? Okay. So in
Yes, sir.
those kind of individual, it would be
Yes.
normal. But if certain condition which leads to pathological dilation, like for example, we have aortic regurgitation, right? So what happens in aortic regurgitation? The blood is going to flow. Like for example, we have aortic regurgitation, right? So for example, if this is your heart, this is your aorta. So in aortic regurgitation, what happens? Blood is flowing back into your left ventricle. If blood is flowing back into the left ventricle, it's a pathological condition. Again, in order to compensate that extra amount of blood for a chronic period of time, the heart is going to undergo eccentric hypertrophy. But this time it's due to a pathological condition, which isn't good. So in aortic regurgitation, again, we are going to hear with sound, S3 heart sound, right? Now you
Yes.
guys know the concept.
Yes, sir.
Yes, sir.
Perfect.
Yes,
It was-
done.
Okay, so whenever in your UWorld question you hear that an individual is having an early, okay, during his early diastole, we are hearing a sound that should be S3 heart sound because early diastole basically leads to S3 heart sound, right?
Yes.
Yes.
So
Right.
S3 heart sound is basically heard during early diastole, okay?
Right.
Let's discuss our second phase of filling. Okay, so this was the first phase. For the first phase, we discussed only your mitral wall is going to be open. The amount of blood, like it's going to be acting as a conduit, right? Like it's going to be acting as a, you can say like a jar storing some blood which is coming from pulmonary vein. If I just, open this, let's suppose a bottle, what happens? The amount of blood which is already present, it would just come down, it would hit the surface, and it would just give us S3 heart sound. What is the second phase of your diastole? So the second phase of diastole is like, for example, if this is your heart, let's suppose your mitral valve. In the second phase, let's suppose these are your pulmonary veins draining into your atria, right? So you guys can see in the second phase, you guys can see the valve is already opened, right? Like for example, if this was your end systolic volume and this was the volume which just come after hitting the surface, right? So now the mitral valve is open. Now the blood directly from the pulmonary vein are going to enter into your left ventricle. Are you guys following me?
Yes.
Because the valve is open. So can I say during the second phase, like your atrium is all like it's only acting as a passage, right? It's only acting as a passage, right? Because the
Yes.
blood directly
Yes.
from pulmonary veins are just coming directly into your left ventricle, right? So this blood is going to again fill your heart till this extent, let's suppose. Okay, so this is the blood which is directly coming from your pulmonary veins filling your left heart. A time would come that now you cannot, like, passively fill the heart, right? So now what happens? Your atria is going to contract, it's going to pull force, it's going to apply force. So now it's going to forcefully fill, it's going to try to forcefully fill your heart, right? And that's going to be the third phase of filling, right? Third phase of filling. So in the
Yeah.
third phase of filling, you're going to have atrial contraction. And this contraction is going to forcefully fill your left ventricle, right? Or forcefully fill your heart. So this atrial kick, this is also known as atrial kick, right? So, for
Yes.
example, in certain group of individual, if they are having hypertrophy of their heart, right? If their heart is hypertrophy, so this atrial kick, whenever the atria is pushing blood forcefully, and for example, if the valves are stiff, if they have undergone hypertrophy, it would produce a sound which is known as S4 heart sound, right?
Yes.
So, can I say that S4 heart sound is heard during late diastole? Can I say that? Why? Because it's
Yes,
due
sir.
to atrial kick
Or arterial
against a
contract.
stiffened wall. Atrial kick or contraction against a stiffened wall, right? Can I say that?
Yes,
Yes.
sir.
Okay.
Yes.
Going to be late. Or in other words, can I say that S4 heart sound is heard in those individuals who have hypertension, because hypertension again leads to stiffening of your
Hypertrophy.
wall, right?
Yeah.
Right.
Is that right?
Yeah.
Yes, sir.
Yes.
Hello?
Hello. Right.
Perfect. So now let's just read our slides, okay? So we just spend a lot of time because I would say it's a really conceptual topic, and I would say like almost 95% of my students are like, they normally face like a lot of difficulties with hard sound and things, okay? So let's read it from slides. Can you guys just see my slides?
Yes.
Hello?
Yes,
Yes.
yes.
Yeah, we can see.
Okay, so okay, perfect. So here you guys can see hard sounds. Okay, so we'll be starting from S1 hard sound. We already discussed that S1 hard sound is basically produced whenever, okay, mhm, okay, sorry. Okay, you guys will be just participating in some of MCQs which I have put for you guys. Okay, just stay here. We're going to make these sessions very interesting. So as one heart sound we discussed is basically produced by closure of your tricuspid and mitral valve, right? We discussed that it is best heard at the cardiac apex. What is your cardiac apex? Mid clavicular line, fifth intercostal space, very important, very high yield. In new world, you are going to see an MCQ. We have an individual, he had a stave wound injury where fifth intercostal space, mid clavicular line. What do you think? Which structure is going to be damaged? Options: right ventricle, left ventricle, right atrium, left atrium. What do you guys think?
Left ventricle.
Left
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 ventricle.
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 Left
It will
ventricle,
be.
perfect, because cardiac apex is basically part of your left ventricle, right? Perfect. For the S2 heart sound we discussed, it's basically produced by closure of pulmonic and aortic valve. But okay, where do we hear pulmonic, like P2 and A2 component? We know that, right? So A2 component is basically heard at the second parasternal intercostal space, right? Remember that, very high yield. But at the right side, and at same area, second left, like at the left parasternal intercostal space, we are going to hear pulmonic valve closure sound, because that's known as pulmonic area and aortic area respectively. I think it's very easy. Okay, so we discussed pathological splitting. It's a wide splitting. Okay, so in ASD we are going to have wide fixed splitting, very high yield. Let's discuss it in a little bit detail, right? So normally we discuss that S2 is going to be split, right? We have S2 splitting. Okay, and why do we hear S2 splitting? You guys are going to be telling me that. Yes. Hello. Hello.
What? Sir?
Sir, because if a patient has ASD, so the amount of blood become high in right atrium. So the blood flow will be the amount will be uh, high. How could I say? English?
Okay, no problem. Let me just
It's
explain it, right?
secondary closure.
So, for example, if this is your heart, right? Let's suppose I'm just drawing the big atria. Okay, these are your atria, and let's suppose these are your ventricles, right? Okay, this is your interventricular septum. Let's suppose if an individual is having ASD, right? Atrial septal defect. So we discussed that left-sided pressure are more as compared to right-sided pressure. So we know that whenever the blood enters and the pressure is more here, so it means that through this defect, during every contraction of your heart, certain amount of blood is going to flow to the right side. Am I right? Like, let's
Yeah.
Yes,
suppose
yes,
during one contraction, let's suppose 20 milliliter of blood is flowing to the right side of the heart. Why? Because the pressure here is high, and the fluid or the blood always flow from high pressure to low pressure, right? So, for example, if with every contraction, 20 milliliter of blood is going to the right side, and this extra 20 milliliter of blood, it would like, it would just come here to the right side, and from the right side, it would just enter into your right ventricle, and it would just enter into your pulmonary artery. This extra 20 milliliter blood is also going to follow, right? So, as we have an extra blood now coming into a pulmonary artery, it means that the pulmonary artery closure is going to be delayed, because now
yes,
more blood is flowing through the valve. Are you guys getting me?
Yeah.
yes, yes.
No?
Yes.
Okay, so let's suppose this extra 20 milliliter of blood would be, let's suppose, delaying the closure for 2 seconds. Let's suppose, right? I'm just giving like appointing some arbitrary numbers, right? So okay, let me just tell you again. with every contraction, let's suppose 20 milliliter of blood is coming to the right side. Okay, 20 milliliter extra blood, I would say. So this 20 milliliter extra blood would just come here and it would just delay the closure of this valve, let's suppose by every 2 seconds, right?
Yes.
Okay. So can I say that it is a wide fixed split? What do I mean by fixed split? That with every beat, you're going to have fixed, splitting seen after 2 seconds, right? So it means that whenever with every contraction, 20 milliliter blood is going to come, it's going to delay the valve closure till 2 seconds. So with every beat, 2 seconds of you know S2 split is going to be seen. Like aorta is going to be closed soon, and later after 2 seconds, let's suppose your pulmonic wall is going to be closing, right? So during ASD, S2 is going to be having fixed split. Fixed split. What do I mean by fixed split? That the split would be hard after fixed amount of time. Why?
Yes.
Because fixed amount of blood is delaying the closure of the valve for the fixed period of time. Is that clear?
Yes, sir. Yeah.
In the UWorld MCQ, you are going to have a lot of MCQ. They're going to be asking, we have an individual, he have fixed split S2 heart sound, just go for ASD, just go for ASD. Write it down, individual with fixed split, ASD. Individual with fixed split, atrial septal defect. And you know the concept. Why? With every beat, specific amount of blood is going to be flowing into the right side, which is going to delay the closure of your valve for specific period of time. Is that clear now?
Yes, sir. Thank
Okay.
Yeah.
Let's just come to our slides that we were discussing. Okay, so we were discussing about ASD. This is okay. So we discussed Frank Salling. Okay, heart sounds. Okay, so here you guys can see atrial septal defect. We have wide fixed split, right? So wide splitting can also be seen in pulmonary stenosis. The idea is really clear. If we have pulmonary stenosis, again, it would delay the closure of P2 component, right? Again, it would delay the closure of your pulmonary valve, which is going to give you split, right? So physiological splitting, we discussed that during inspiration, it's going to be widened. We know why, because during inspiration, right-sided heart preload would increase, left-sided heart preload would decrease, which is going to lead to physiological S2 splitting. For the S3 heart sound, we discussed its rapid passive ventricular filling. Why rapid passive ventricular filling? Because it's the amount of blood that is whenever the mitral valve open, rapidly the blood which is already being stored in your left atria is going to come. It's going to hit the surface of the blood, giving you S3 heart sound. Here you guys can see, very important. It is basically heard at the bell of stethoscope. You guys know that you have the diaphragm of stethoscope, and the back side is basically known as bell, right? This is one of your UWorld MCQ, and it is best heard during end expiration. Like as I'm expiring during end expiration, I'll best heard hear S3 heart sound. Why? Because at end expiration, S3 heart sounds are, and S4 they are also known as gallop heart sound. Like they're slow intensity heart sound, right? So you can only hear it with the bell of stethoscope. And why during the end of expiration? Because during end of expiration, your heart is close to your thoracic wall cavity, right? So whenever your heart is close to your thoracic wall, now you can best hear these S3 and S4 heart sound, right? So we discussed during pregnancy, it's normal. Why? Because during pregnancy lead to volume overload state, which is going to increase eccentric hypertrophy. During heart failure, again, your heart is going to deal with a lot of blood. And as your heart is failing, it can't pump blood. If it can't pump blood, you are going to have more blood within your heart. More blood within your heart, now you're going to have here S3 heart sound because more surface of blood hitting the surface of blood is going to give you this sound. For the S4 heart sound, we discussed it's basically heart at the end of your of your like diastole. It is due to atrial kick towards the stiffened wall. Whenever the atria kick against the stiffened wall, you're gonna hear S4 heart sound. Again, it is heard at the left decivitus position during expiration because heart is close to your thoracic wall. Again, it's going to be heard at the bell of stethoscope. We discussed in elderly, we are going to hear S2 heart sound. Why? Because they have hypertension. If they have hypertension, we discuss the afterload increases, and afterload increases, it's going to lead to concentric hypertrophy. If you have concentric hypertrophy, heart is going to become stiffened. If the heart becomes stiffened, now you are going to hear S4 heart sound. That is atria kicking against your stiffened heart valve. In chronic hypertension, the idea is again same. Aortic stenosis, again the idea is same, right? So this is going to be our last MCQ for today, and who is going to be answering me this MCQ? Yes, please raise your hand, those who want to participate. Dr. Rehab. Rehab?
Yes.
Dr. Rehab, can you just please turn on your mic? Can you just please read this MCQ for us?
Yes. Hello.
Yes.
Should I read the question?
Yes, please read the question. Start from the end, like 3 to 4 lines. As we discussed, this is going to be our pattern for reading our USMLE MCQs. Yes.
Okay. Cardiac image shows hypokinesis of the left
Okay, just
ventricle.
start from last 3 to 4 lines. Just start from on cardiac auscultation,
On
a low
cardiac
frequency
auscultation,
diastolic. Huh?
on cardiac auscultation, a low frequency diastolic heart sound is heard shortly after the second heart sound. When the patient lies in the left lateral decubitus position, cardiac image
Okay.
shows hypokinesis of the left ventricular wall. Which of the following is most likely to attenuate this patient abnormal auscultation finding?
Okay. Just
Option
read the
E.
MCQ from beginning now.
Um,
Okay. First
listening
of all, I
ability.
want to ask
Sorry.
you. I want to ask you, which heart sound are they referring towards? What do you
History.
think? Right?
Three.
Okay. S3. Okay. Yes. Why do? Why are you saying it's an S3 heart sound?
Because it's early
Because it comes
diastolic sound.
after it's two.
It's an
After,
early diastolic sound, right?
yes.
Okay, perfect. Yes. So just start the MCQ from beginning. A 53-year-old man comes to office due to difficulty breathing and increasing fatigue. He has shortness of breath at night. Okay, where MCQ just get disappeared. Sorry for that. Just give me a second. Okay. Mhm. So here you guys can see the medical history is significant for hypertension and hyperlipidemia. 2 months ago, the patient suffered a myocardial infarction that was not revascularized. We discussed a 3 heart sound can be heard whenever a person is having a cardiac heart failure as well, because that's going to lead to, yes, volume overload state, right? If your heart cannot pump blood, it means your heart is in volume overload state, right?
Yes.
So it means it's an S3 heart sound. So which of the following is most likely to accentuate this patient abnormal auscultation finding? What do you guys think? Yes. When do we best
Having
hear
the
S3
patient
heart
stand up.
sound? We discussed it.
At
We
the end of
discussed it.
expiration.
When do we hear these S3 and S4 heart sound best?
End expiration.
And
Why?
end of
Expiration
expiration.
lateral
Why?
decubitus.
Expiration.
Why?
Heart comes closer to
Why?
the chest wall.
Chest wall.
Yes, during end expiration, heart is close to your chest wall. This is your exact NBME MCQ, right? NBME 30. So we have discussed each and everything in detail. That was all about our workshop. Thank you guys for staying here. Hope so you guys enjoyed. If you guys want to continue these kind of sessions with us, you can join our 120 days marathon session in which we are going to have these discussions on daily basis. Besides that, we'll also be having discussion on UWorld with Dr. Maheen. Dr. Moaz is also going to be there. Both of them are internal medical resident in the US. Their first year is going there in Oklahoma and in California. Okay, there is a hospital. So we'll just introduce them as well. They are highly specialized tutors. So if you want to have like such kind of, if you want to continue this, so we'll be starting from cardiology back again. So we have limited slot left. And let me just mention, a lot of students asking that is it a free program or is it a paid program? So that's a paid program, but the fee for the program is very minimum, right? Like for the entire 4 months, it's only 150 USD, right? So our community is basically profit-free community. We do not take profit from the students. Like currently, we are only just taking these charges, just give it to our mentors. Okay, so 150 USD for 4 months. If you just calculate it per month, so it's less than 50, right? And you guys are going to have daily discussion, daily access to our library as well. We'll be just giving you our question banks as well. You can just read that as well. And we have limited source left. Thank you guys. Thank you so much. Hope so you guys enjoyed. If you want further details about the marathon, so just reach me out or read Dr. Hamza out. Okay. So we'll be having, after this session, we'll be having an assessment based on the questions which we discussed and some of the cardiovascular. So kindly just attend that assessment as well. After that, we'll be just giving you certificates for this workshop. Hope so you guys enjoyed the workshop. If you guys have any questions about the marathon or anything, you guys can just open your mic. Let's have a question and answer session, please. Any questions? Okay. I think no questions. Okay. Thank you so much. Thank you and have a nice day. Bye-bye.
Thank you. Have a nice day.
Thank you, sir. Thank you so much.
You're
Thank you, sir.
welcome.
Thank you.
Thank you, doctor.
You sir.
Yes, sir.